Apothecary, əཔεθᵻkəri, is one term for a medical professional who formulates and dispenses materia medica to physicians, surgeons and patients. The modern pharmacist has taken over this role, and in some languages and regions the word is still used to refer to a retail pharmacy or a pharmacist who owns one. The apothecary's investigation of herbal and chemical ingredients was a precursor to the modern sciences of chemistry and pharmacology. In addition to dispensing medicines, the apothecary offered general medical advice on a range of services that are now performed by other specialist practitioners, such as surgeons and obstetricians. Apothecaries often operated through a retail shop which, in addition to ingredients for medicines, sold tobacco and patent medicines. Etymology: apothecary derives from the ancient Greek word piomicron theta eta caparate, the via Latin apotheca, medieval Latin apothecarius, and eventually Old French apothecary. In some languages the word apothecary is still used for designating a pharmacist, chemist, such as German and Dutch and Luxembourgish. In some regions of the United States, especially northeastern cities such as Philadelphia and Boston, many independent pharmacies have the word apothecary in the name of the business. Likewise, pharmacy translates as apothec in the Scandinavian languages. History: apothecary as a profession could date back to 2600 BC to ancient Babylon, which provides one of the earliest records of the practice of the apothecary. Clay tablets were found with medical texts recording symptoms, the prescriptions, and the directions for compounding it. The papyrus Ebers from ancient Egypt, written around 1500 BC, contain a collection of more than 800 prescriptions, or ancient recipes for the apothecaries of the time. It mentions over 700 different drugs, according to Sharif Kaf al-Ghazal and S. Hadzovich. Apothecary shops existed during the Middle Ages in Baghdad by Islamic pharmacists in 754 during the Abbasid Caliphate, or Islamic Golden Age. Apothecaries were also active in Islamic Spain by the 11th century. By the end of the 14th century, Geoffrey Chaucer was mentioning an English apothecary in the Canterbury Tales, specifically the Nun's Priest's Tale, as Pertolot speaks to Chanticleer. And for ye shall not tarry, though in this tune is noon apothecary, I shall myself to herbies taken now, that shall been for your heal and for your reprow. In modern English this can be translated as ... and you should not linger, though in this town there is no apothecary. I will teach you about herbs myself, that will be for your health and for your pride. For the 15th century to the 16th century, the apothecary gained the status of a skilled practitioner, but by the end of the 19th century, the medical professions had taken on the current institutional form, with defined roles for physicians and surgeons, and the role of the apothecary was more narrowly conceived as that of pharmacist. In England, the apothecaries merited their own livery company, the Worshipful Society of Apothecaries, founded in 1617. Its roots, however, go back much earlier to the Guild of Peppers formed in London in 1180. Elizabeth Garrett Anderson became the first woman to gain a medical qualification in Britain when she passed the Society's examination in 1865. In Renaissance Italy, Italian nuns became a prominent source for medicinal needs. At first they used the knowledge in non-curative uses in the convents to solidify the sanctity of religion among the sisters. As they progressed in skill they started to expand the field to create profit. This profit they used towards the charitable goals. Because of their eventual spread to urban society, these religious women gained roles of public significance beyond the spiritual realm. Later apothecaries led by nuns were spread across the Italian peninsula. In German-speaking countries, such as Germany, Austria and Switzerland, pharmacies or chemist stores are still called apothecaries, or in German Apotheken. The apotheker is legally obligated to be run at all times by at least one apotheker or apothecarin, who actually has an academic degree as a pharmacist, in German Pharmazitten, and has obtained the professional title apotheker, by either working in the field for numerous years, usually working in a pharmacy store, or taking additional exams. Thus, Pharmazit is not always an apotheker. Magdalena Neff became the first woman to gain a medical qualification in Germany when she studied pharmacy at the Technical University of Karlsruhe, and later passed the apothecaries examination in 1906. Apothecaries used their own measurement system, the apothecaries system, to provide precise weighing of small quantities. Apothecaries also were known to accept special requests for vials and poisons. Recipes. Many recipes included herbs, minerals, and pieces of animals that were ingested, made into paste for external use, or used as aromatherapy. Some of these are similar to natural remedies used today, including catnip, chamomile, fennel, mint, garlic and witch hazel. However, many other ingredients used in the past, such as urine, fecal matter, earwax, human fat, and saliva, are no longer used and are generally considered ineffective or unsanitary. Noted apothecaries: Hildegard of Bingen, Paracelsus, James Parkinson, Dante Alighieri, Benedict Arnold, Sylvanus Bevan, Emile Coué, Nicholas Culpeper, John Keats, Nostradamus, John Parkinson, Joseph Proust, Nicholas Hughes,